Radio.
Prepare yourself.
Ang silid-aralan sa radyo, hatid namin ay makabagong paraan ng pagtuturo at kalaman. Mapaumaga, tanghali o hapon man yan, ang istasyong magbibigay impormasyon kahit saan man.
For something big.
Alright, here we go.
106.3 Dance Radio. Doña Aurora National High School, Santa Rita, Aurora, Isabela.
This
106.3 DWDR-FM. Music, arts, physical education, and health. Mga aralin na dapat malaman, inyong tututukan dito sa 106.3 Dance Radio. Ang istasyong magbibigay ng edukasyon kahit saan man at ang silid-aralan sa radyo 106.3 DWDR-FM. Sa MAPEH, learning is amazing!
Okay, good morning grade 10 learners and welcome once again to our MAPEH Quest in Health 10. It's our 4th week now for the first shift for the second quarter. Every individual is faced with various health issues and concerns. They may be brought about by problems in persons' physical health, threats in safety, concerns about managing finances, conflicts with other people, and social relationship, and a lot more. In this light, awareness is very important factor. If we are knowledgeable of the different policies, we would be able to know our rights. But before we go on with our discussion for today, let me greet all my classes from 10 Einstein, Mendeleev, and Rutherford. Gising na mga anak at tumutok sa ating live discussion for this day. 11 days to go, Christmas na mga kasama. Sir Ives.
Pero before yan, ma'am, magbabakasyon na. Last week na po natin para sa taong 2021. Shout out po sa aking mga estudyante from 10 Tanggile and 10 Tindalo. Mag-comment na po sa ating chat box ang inyong pangalan, section, and our official hashtag for today, hashtag MAPEHQuest. Of course, shout out din po sa mga estudyante ni Sir Francis, ang 10 SPA Obra and ang 10 SPA Sinagtala and 10 Yakal. Mag-comment na rin po sa ating official sa ating comment box and of course our official hashtag this morning.
Okay, magandang umaga sa aking mga magaganda at mga gwapong mga 10 Mulabe at 10 Banaba. Gising-gising na mga anak. At sa mga estudyante ni Ma'am Chatra Milay Kalimos, ang kanyang 10 Talisay. Gayun din ang kay Sir Mark Bagamaspad, ang kanyang 10 Mahogany and 10 Lawan. Good morning!
Thank you, Ma'am Ana. And of course, advance Merry Christmas 10 grade 10 learners. Ayan. Hello to my 10 SPJ class. Of course, shout out din po for the classes of Sir Mark John Domingo, ang 10 Almasiga, 10 Gemelina, 10 Camagong, and of course, for Sir Arnal Simon, 10 Nara, 10 Keisha. Okay, comment down your name and your section, and for those section for Sir Mark John Domingo, Sir Arnel, and sa 10 SPJ ko, hashtag health trend para ma-check ko ang inyong mga attendance.
Okay, as of now, meron tayong
Yes,
70
Ma'am Joanna,
viewers,
of course.
Oo, madami tayong viewers.
Yes,
ngayon.
aside from it, Ma'am Joanna, siguro great rin natin ang ating administrators.
Yes.
Ayan. Of course, good morning to our Chief Education Supervisor, our OIC, Dr. Rodrigo B. Pascua.
Good morning, sir.
Good morning, sir. To our Assistant Principal, Ma'am Ruby R. Guillermo. Napaka-workaholic ni Ma'am Ruby. Good
Hello,
morning,
ma'am.
ma'am.
Good morning po.
And of course, to our equally talented and skillful head teachers of our school, Ma'am Emily, Ma'am Ophelia, Sir Ferdy, Ma'am Jackie, Ma'am Merlinda, Ma'am Annabelle, Sir Jefferson, and of course, our head teacher from the MAPEH learning area, Sir Leonidas C. Bernardo. To all our administrators, good morning po sa ating lahat. Yan po. Sir Ibes?
Ayun na. Makinig na po. Ay, Eto, Ma'am Joanna.
Yes. Thank you, grade 10 teachers. Hoping ng ating mga grade 10 learners ay na ready in listening to our lesson for today. As of now, nakikita ko sa aking screen ang 84 viewers. And with that, we are encouraging all grade 10 learners, yung mga hindi pa nakakapasok, to listen, watch, and participate in all activities in today's episode in Health 10.
And of course, they will be learning a lot today, Ma'am Joanna.
Yes, so what are to expect to our lesson for today? At the end of this lesson, the learners of grade 10 are expected to recommend ways of managing health issues, trends, and concerns, and explain the significance of the existing health-related laws in safeguarding people's health. Ma'am Ana.
Okay, before we go on with our discussion in Health 10, pakinggan muna natin ang airing ng radio-based instruction in Health 10.
Yan, magbabalik kami after ng airing ng ating RBI Health 10.
Music, arts, physical education, and health. Mga aralin na dapat malaman, inyong tututukan dito sa Dance Radio. Ang istasyong magbibigay ng edukasyon kahit saan. Ito ang 106.3 Dance Radio. Totonia Aurora National High School, Santa Rita, Aurora, Isabela. Ang silid-aralan sa radyo. 106.3 DWDR-FM. Dance Radio. Sa MAPEH, learning is amazing.
Good day, grade 10 learners. I am glad to be with you in 30-minute broadcast. I hope that you will enjoy our interesting topic. Please get your writing materials and module so we can start our lesson in Health 10. The module provides you the different activities that will help you become familiar with the topics or lessons about health, trends, issues, and concerns. Assistance of your parents, siblings, or relatives are encouraged in answering the module, particularly in the activities where you need to perform tasks. Are you ready to start?
Yes, ma'am.
Good luck! From the previous lesson in Health 10, you have learned about consumer health and its components. What are the components of consumer health?
Ma'am, the components of consumer health are health information, health products, health services, and health insurance.
Very good! How will you differentiate reliable sources of information from unreliable sources of information?
Ma'am, reliable sources of health information are those licensed professionals who took up specialized and intensive studies in the field.
Good answer! How about unreliable sources of information?
Ma'am, unreliable sources of information are those people who are not experts in the field.
That's great! Now, what is the vision of PhilHealth?
Ma'am, the vision statement of PhilHealth is bawat Pilipino miyembro protektado, kalusugan ng lahat protektado.
You are right! What is the purpose of that vision?
Ma'am, it ensures that every Filipino is a member by covering them under different membership programs which are categorized according to various sectors of our society.
Very well said! Always remember, as consumers, we have so much power to change the world by just being careful in what we buy. At the end of this RBI lesson, you are expected to recommend ways of managing health issues, trends, and concerns, and explain the significance of the existing health-related laws in safeguarding people's health. To begin our discussion, let us listen to this news, and later on, we're going to analyze the content of the news. Here is the news.
Sa panahon ngayon, kailangang magdoble ingat dahil hindi na lamang sa kalsada, tahanan, trabaho o sa mga pampublikong lugar nagaganap ang mga krimen. Nag-level up na rin ito at sumabay sa high-tech na panahon. Isa nga ang assistant director ng mga indie films na si Camille Aragona sa nakaranas ng kriminalidad online. Siya ay ninakawan ng pagkakakilanlan.
That day, parang ang dami na. Nakita ko, ang dami Tingnan ko, kinlik ko siya, tapos ang daming messages. Balik mo yung pera namin, papapulis daw ako.
Nung una, hindi pa siya naniwala hanggang kumalat pa sa iba niyang social media accounts ang hinaing ng mga taong umano'y naloko niya.
Napraning lang ako nung nakita ko yung post na ng isang client noon na niloko at na-picture ko na nakalagay manluloko, magnanakaw ako.
Dito nalaman ni Camille na ginamit ang kanyang pagkatao sa isang website para magbenta ng kamera sa napakamurang halaga.
Nalaman namin na this person posted something, it's worth 10,000 pesos. So syempre, naturally, maraming kakagat doon kasi mura.
Ang kaso ni Camille ay hindi na raw bago ayon sa PNP Anti-Cybercrime Group dahil parami na ng parami ang nasasangkot sa mga krimen sa cyberspace sa paglipas ng panahon.
Cybercrime is for 2016 we have 1,937. For 2015, 1,098. Those are cyber criminals. Walang physical contact doon.
Kadalasan po ang mga fake users ay hindi lang nanggagansyo. Madalas ito po'y ginagawa nila para manira ng kapwa-tao. Ang tawag sa kanila ay mga trolls. Yun hubang ang profile picture sa account ay kahina-hinala at halos wala pong post o kaya po naman ay followers sa kanilang account. Naranasan nga ng Pinoy Big Brother Teen Edition 4 Big Winner Myrtel Sarosa kung paano atakihin ng trolls.
Meron na mga sobrang intense na bashers na yung mga sinasabi na nila sa akin, yung parang mamatay ka na, to the extent na gagawa lang sila ng account para i-bash ka.
May impostor naman daw si Nadia Montenegro sa social media.
Isang araw galit na sa akin ng mga kapatid natin sa isang religious group dahil yung isang fake account na ginamit yung pangalan ko, isang poster ko, tinira ng tinira at mga kawalang hiyan lahat ang sinabi.
Ayon sa isang information technology expert, marami ang gumagawa ng cybercrime dahil nakakalusot ang mga pasaway sa kasalukuyang account registration process ng mga social media sites.
Madaling mag-create ng social media account, pero ang tanong dyan is yung proseso ng verification. Paano i-check na yung tao na nag-create ng social media account ay kung sinong siyang sinasabi niya.
At mahihirapan din daw habulin sa pananagutan ang mga nasa likod ng fake accounts.
Mas lumalaki ang hamon sa paghahanap sa kanya kapag ang kanyang ginamit ay halimbawa ay ang cellphone, isang smartphone. Kasi wireless yan. Maaring tuwing nag-a-access siya dun sa social media account, gumagalaw siya. Wala siyang fixed na position.
Dahil sa problemang ito, nakaisip ng isang panukala si House Speaker Pantaleon Alvarez na minsan na rin daw na biktima ng bashers nung nakaraang eleksyon.
Well, kinakailangan ito dahil nga alam naman natin na yung social media, talagang ito ay lumalaki. Mas parami yung gumagamit nito.
Sa kanyang House Bill 5021 o Social Media Regulation Act of 2017, magiging masinsinan na ang verifikasyon sa pagkakakilanlan ng mga social media users.
You have just listened to the news. What can you say about the news?
Ma'am, the news is all about identifying theft case with the use of social media?
You are right! What social media bill is responsible with this kind of cases?
Ma'am, the Cybercrime Act of 2012 is responsible with the different crime regarding the use of social media.
Correct! Nowadays, we must be very careful in using our social media account to protect ourselves against cybercrime. Let's pause for a short break.
Nangangamba ba ka magka-COVID?
Huwag mag-alala. Narito ang mga tips upang makaiwas sa COVID-19.
Una, social distancing. Umiwas muna sa matataong lugar. Huwag lumabas ng bahay kung hindi naman kinakailangan. Kung may distansya, safe ka.
Ikalawa, panatilihing malinis ang katawan.
Ugaliin ang paghugas ng kamay.
Sabon at alkohol are real.
Palakasin ang katawan.
At vitamins ay huwag kalilimutan.
At ikatlo, laging magsuot ng face mask bilang proteksyon laban sa virus. Kung protektado, siguradong sa virus ay negatibo.
Mga kapatid, tips ay tandaan upang COVID-19 ay maiwasan.
Isang mensahe mula sa MAPEH Learning Area at ng impilang ito.
Uy, Pedro! Nagpabakuna ka na ba?
Oo naman, Petra. Bakunado na yata to. Dapat ang bawat isa ay mahikayat ng magpabakuna. Bata, matanda, tara na!
Tama ka dyan, Pedro! Kung may bakuna, siguradong protektado tayo laban sa virus. Kaya magpapavaksin na rin ako.
Tandaan, magpabakuna. Siguradong protektado ka.
Isang mensahe mula sa MAPEH Learning Area at ng impilang ito.
Kayo nakikinig sa Health Grade 10. Kasama si Teacher Monica GLB.
I'm back! Our lesson for today focuses on common concerns, trends, and issues of adolescents in the country. Each of us must be familiarized with the policies concerning our safety, for we will learn more about the policies that will protect us, as well as the impact of these policies to the members of our family, country, and all citizens in the Philippines. What is Republic Act number 7394?
Ma'am, this act is known as the Consumer Act of the Philippines.
Correct! The act has 3 objectives. First, it protects the interests of the consumer. Second, it promotes his or her general welfare. And third, it establishes standards of conduct for business and industry. How to achieve its objectives?
Ma'am, the Act aims to protect people against hazards to health and safety and deceptive and unfair sales acts and practices.
You were right! What else?
Ma'am, the policy mandates for information and education to facilitate sound choice and proper exercise of rights by the consumer.
Correct! The policy, on the other hand, promotes the protection of citizens against hazardous substances that may be in sale. Hence, proper labeling and fair packaging shall be required for all the products being sold. Is that clear?
Yes, ma'am.
Now, what are the steps if a consumer wants to complain about the products and services rendered?
Ma'am, first, we have to identify the problem.
Correct! What do you think is the way to solve the problem?
Ma'am, we can return the products to the store for replacement so that we can refund the money.
Correct! In that case, you should explain the problem in a nice way. What else?
Ma'am, show a proof of purchase.
Yes! How will you do that?
Ma'am, we can show them the proof of purchase such as receipts and warranties that can support our purchase.
You are right! It is very important to always keep the receipts that serve as our proof of purchase to guarantee an efficient return process. Are there some more?
Ma'am, we should report the complaint.
Very well said! Report the complaint to the proper authority, explain the problem, and tell clearly what action we would like to be taken. Any more idea?
Ma'am, write a letter of complaint.
Very good! If we are not contented with the response, we will write a letter of complaint to the protection agency concerned. Important thing on writing a complaint is to give the complete details. State your name and address, and the name and address of the establishment which you are complaining. Is that clear to everyone?
Yes, ma'am.
Let us proceed to the next Republic Act, which is Republic Act number 10354. Tell something about this Republic Act.
Ma'am, it is also known as the Responsible Parenthood and Reproductive Health Act.
Very good! This act built its foundation of pillars. What are those pillars?
Ma'am, the first one is informed choice. It covers the provision for the integration of reproductive health and sexuality education in schools and other educational settings.
Yes! What are those key areas to be integrated in all subjects?
Ma'am, we have the right of the child, child health nutrition, and child and adolescent development.
Correct! What else?
Ma'am, we also have age-appropriate sexuality education, population and development, and marriage and family.
Great job! Are there some more?
Ma'am, schools will also integrate gender and development, life skills, and prevention of STIs, including HIV and recognition of gender-based violence.
Very good! What is the second pillar of foundation?
Ma'am, respect for life. It recognizes that abortion is illegal and punishable by law.
You are correct! However, mothers who were found to have aborted an unborn child will be served with post-abortive treatments and counseling in a humane, non-judgmental, and compassionate manner. What is the third pillar of foundation?
Ma'am, birth control. It is all about reproductive health care, information, and supplies shall be made available most especially to poor beneficiaries.
That's great! However, the Act provisions also that the government must respect the citizens' individual preferences and choices of family planning method. Am I understood?
Yes, ma'am.
That's good. How about the last pillar of foundation?
Ma'am, responsible parenthood, wherein the couple should determine and plan their ideal family size.
Very good. In addition, the government shall equip each parent with needed information in all aspects of life, reproductive health, and this pillar. What is now the importance of knowing about this law?
Ma'am, knowing this law will help individuals and couples determine freely and responsibly the number, spacing, and timing of their children.
That's right! And for that, it should be ensured that all children are wanted and loved and will properly provided for by their parents. Am I understood?
Yes, ma'am.
That's good. The next policy is Republic Act number 8504. What is all about this?
Ma'am, it is known as the Philippine AIDS Prevention and Control Act of 1998.
Correct. What is all about this policy?
Ma'am, the act promulgates policies and prescribing measures for the prevention and control of HIV or AIDS information and educational program, establishing a comprehensive monitoring system and strengthening the Philippine National AIDS Council.
Exactly. Aside from that, the Act also provides for education and information dissemination in various institutions and agencies, safe practice and procedures in health organizations and associations, monitoring cases with confidentiality and programs for anti-discriminatory acts. Am I clear?
Yes, ma'am.
Now, how can you help a person living with HIV or AIDS?
Ma'am, I can talk to the person suffering from HIV, listen also about his side, and learn based from his or her experience.
That is right. What else?
Ma'am, we should also encourage the concerned person concerned to have treatment and then support medication adherence and support the victim to fight for himself.
Very well said. Now, how can we give education and information offerings in the prevention of HIV or AIDS?
Ma'am, we can conduct face-to-face instruction as in tutorials, seminars, workshops, and discussion groups.
Correct! Any more?
Ma'am, we can also print materials as in modules and other self-instructional materials, brochures, flyers, comic books, and magazines.
Very good. What else?
Ma'am, we can also use technology through audio and audiovisual activities.
That's a brilliant idea. Another?
Ma'am, HIV or AIDS distance education where self-instructional materials are sent to the target audience in accordance with adult learning principles.
Very good! Why do we need to be aware of HIV or AIDS infection?
Ma'am, HIV or AIDS awareness program help people become aware of the levels of care and treatment that helps people to be more careful and ultimately decreases infection rates.
That's a good idea! Therefore, education is an important component of preventing HIV or AIDS. Even if education were completely successful, it would still have to be an ongoing process. Each generation, a new generation of people become adult and need to know how to protect themselves from infection. The next one is the Republic Act number 7719 or the National Blood Services Act of 1994. What does the said law promote?
Ma'am, it aims to promote and encourage voluntary blood donation by the citizenry, provide for adequate, safe, and affordable and equitable distribution of blood and blood products.
Correct! How are we going to promote and ensure adequate supply of human blood through voluntary blood donations?
Ma'am, it can be done through public education and promotions in schools.
Very good! What else?
Ma'am, we can also promote it through professional education.
Correct! Anything more?
Ma'am, it can be promoted also in the different establishments establishments of blood services network as well as the walking blood donors.
That is right! Why should people donate blood?
Ma'am, donating safe blood can save lives.
Very well said! Do you think blood donation during COVID-19 pandemic is essential?
Yes, ma'am.
Donating blood, especially this time of COVID-19, is more essential than ever because every few seconds, someone needs blood that helps save a life, and donating safe blood can make the world a healthier place. Let's proceed to the next law, the Republic Act 10175. What is this law known for?
Ma'am, it is the Cybercrime Prevention Act of 2012.
Correct! What is all about this law? Do you have any idea?
Yes,
Yes,
ma'am.
ma'am.
The law mandates the prohibition of cybersex, child pornography, unsolicited commercial communications, and computer-related identity theft.
Very good! How could you avoid being a victim of cybercrime?
Ma'am, always keep our social media accounts private.
That is correct! What else?
Ma'am, use a unique password in every online account.
Yes, it is true. Are there some more?
Ma'am, we can protect our computer system against intruders by installing antivirus and by activating our firewall.
You were right. Any more?
Ma'am, remember the phrase, think before you click.
Correct. Any more idea?
Ma'am, we can also initiate a background investigation of a person's social media account who is not known to you personally before befriending or accepting a friend request.
You are all correct. Cyber law is important for it helps in establishing social legal sanctions for cybercrime and protects users by preventing harm to people, data system, services, and infrastructure. Before we continue with our activity, let's have a short break.
Buboy, pumasok ka na rito at kakain na tayo. Itigil mo na yung paglalaro.
Sayang, mag-home base na ako. Si Nani naman, wrong timing.
Nako, kapag tayo po ay uubo o babahing, mangyaring takpan ng ating ilong o bibig ng siko o tissue upang maiwasan ang pagkalat ng virus.
Sinigang para sa tanghalian.
Amoy pa lang, panalo.
Wait! Ugaliin po natin ang puspusang paglilinis ng kamay gamit ang sabon, hand sanitizer at alcohol. Patuloy pa rin ang banta ng COVID-19 kaya tayo ay maging responsableng mamamayan. Sa kaligtasan ng bayan, disiplina ang kailangan. Stay home, save life.
Isang paalala mula sa RHO Aurora Isabela. Kayo nakikinig sa Health Grade 10 kasama si Teacher Monica Jill B.
I'm back! This time, let us accomplish What's New? Activity 1 titled Sentence Completion. Directions. Complete the given statements. Write your answers on a separate sheet of paper after the broadcast. For your performance task, Activity 2 titled Slogan on Drug Education. Directions. Make a slogan about helping and reminding young people to avoid dangerous drugs. Use not more than 12 words. Submit your activity to your respective MAPEH teacher. Do not forget to answer the activity titled Be Aware. Directions. In 2 to 3 paragraphs, answer the question. Here is the question. As a grade 10 student, how could you protect yourself from cybercrime? Write your answer on a separate sheet of paper after the broadcast. Am I understood?
Yes, ma'am.
Let us have a recap of our lesson today. What have you learned from our discussion?
Ma'am, we have learned the different policies and laws that cover various concerns, and it is our duty as citizens to abide by and promulgate these laws.
Correct! What else?
Ma'am, we also recommended ways of managing health issues, trends, and concerns.
Very good! Any more?
Ma'am, we also explained the significance of the existing health-related laws in safeguarding people's health.
Remember that all of those laws help provide for our general safety. Before we end up our lesson, let me check if you really understood our lesson by determining whether the given statements are true or false. Here is the first statement. Responsible parenthood and reproductive health is a law that guarantee universal access as methods of contraception, fertility control, sexual education, and maternal raise. Is it true or false? What is your answer?
Ma'am, the answer is true.
Very good. Second statement. A person with HIV or AIDS is allowed to donate blood, tissues, or organs. What is your answer?
Ma'am, it is false because it is illegal to give blood if you know you have tested positive for HIV.
Correct! All donated blood is taken to our laboratory and tested for several infectious diseases. For your last activity, reflection part, answer this question. Do you think awareness is an important factor regarding the different policies and laws in our country? Why? Write your answer on a separate sheet of paper. Do not forget also to answer the validating questions. Do all your activities in your most convenient time after the broadcast. Congratulations! We are done with today's lesson. I hope you have learned a lot from our discussion. Remember to seek the assistance of your respective MAPEH teachers through their mobile phones or messenger if you have questions. I would like to acknowledge the people behind this RBI lesson. Teacher Joanna Marie Anco Esomiendo, the script writer. Teacher Fausto S. Maneja Jr., the content editor. Teacher Beverly L. Ramirez, language editor. Chatramilaika C. Limos, our technical specialist. And our overall quality assurance team, Sir Leonidas C. Bernardo. Ma'am Ruby R. Guillermo, our assistant school principal. And Dr. Rodrigo V. Pascua, Chief Education Supervisor and Officer in charge of the school. This is your radio teacher, Teacher Monica G. Limpin. Saying, if we desire respect for the law, we must first make the law respectable. Thank you and goodbye!
Music, arts, physical education, and health. Mga aralin na dapat malaman, inyong tututukan dito sa Dance Radio. Ang istasyong magbibigay ng edukasyon kahit saan,
Ito ang 106.3 Dance Radio. Totonya Aurora National High School, Santa Rita, Aurora, Isabela. Ang silid-aralan sa radyo. 106.3 DWTR-FM. Dance Radio. Sa MAPEH, learning is amazing.
Dance Radio, silid-aralan sa radyo, atid namin makabago, paraan ang pagtuturo.
Wala nang makakapigil pa. Sulong Arangkada 106.3 Dance Radio sa Aurora, Isabela.
Edukasyo'y susulong, basta't magtulong-tulong, sulong edukalidad. Dance Radio, learning is amazing.
So there we have it, ladies and gentlemen, our radio-based instruction in Health 10. Let us now proceed to the first part of our live discussion. Let's have our review on our previous lesson in health.
Okay, from the previous lesson, you have learned about consumer health and its components. Balikan nga natin kung ano yung mga components ng consumer health. You can comment down your answers, our dear learners, in our chat box. Tignan nga natin kung natatandaan nyo ang lesson natin ng first quarter in Health 10.
Ayan. Ayan, may nag-comment na.
Okay.
Okay.
Sir Dante, may nag-comment na ba?
Okay, the component of consumer health.
Ayan,
Sabi
siguro.
na, ito na. Health information, health services, health products, and health insurance. Okay, ang galing.
Yeah.
Very good.
Very good.
Ang daming nakakuha ng mga grade 10 learners sa sagot.
Maraming nagpapahabol. Pero ma'am, why is consumer health important? Bakit nga ba importante ang consumer health?
Okay, so lahat tayo, consumer. Being a wise consumer is important kasi nakakatulong ito na maging aware tayo sa quality ng goods na ating binibili. So, napaka-importante yon. Then another is, nakakatulong ito or nag-encourage sa atin ito na maging careful tayo doon sa mga services na ating ina-avail, sa mga products na ating binibili. And in that case, binibigyan tayo ng knowledge na i-apply natin yung mga existing laws ng about sa protection ng rights ng consumer. Di ba, Sir Dante?
Yes, Ma'am Joanna, that's really a great one. And I hope, and we hope, teachers, na ang ating grade 10 learners ay they have applied what they have learned from the previous quarter in their day-to-day living, because all of us are considered to be a consumer. Okay? And being a consumer, we must exercise our right. Okay? Pag alam natin na nababiolate ang right natin, of course, you are being taught already with our rights during the previous quarter. Okay? So, ngayong umaga, Ma'am Joanna, madadagdagan palalo ang kaalaman ng ating grade 10 learners, especially on our rights.
Yes,
tama ako, Ma'am Joanna?
Tamang-tama at marami silang matututunan ngayong araw. But before we go further with our lesson, let us watch this video and later on, we will identify the content or the issue all about. So siguro, Sir Ives, pwedeng basahin yung mga nasa video for those who are listening over the radio.
Sure po.
Okay.
Yeah, for those who are listening to radio, you can text using your cell phone on this number 0915-380-1112 for us to recognize your answer. Ulitin ko yung number 0915-380-1112.
Okay.
Through your life, helping countries make the air you breathe safer.
Promoting healthy diet to prevent diabetes, cancer, and heart disease.
Helping you monitor how your children are growing and know what to do if they are not growing as expected.
Recommending vaccination to keep the family healthy and helping countries survey how many people get the immunization they need.
Keeping your food safe to eat.
And your water safe to drink.
Ensuring availability of safe, modern contraceptives for everyone.
Increasing seatbelt and helmet used to save lives on roads.
Helping reduce your health risk while traveling.
Understanding and planning for the needs of older people.
Protecting you from secondhand smoke in public places.
Ensuring bed nets and diagnostic tests are of good quality to protect people from malaria.
Helping countries ensure they recruit health workers on the basis of ethics and good practices.
Protecting patients from infections in health facilities.
Ensuring good care for mother before, during, and after delivery.
Including testing and treating for HIV.
Sending in experts, medicines, equipment, and supplies when disaster strikes.
Helping protect people from catastrophic health bills and reducing inequities.
Ensuring access to safe and affordable medicines.
Identifying disease outbreak early and helping countries to respond.
So, what is the video all about? Sa mga estudyante pong nakikinig or nanonood sa ating live streaming, comment now your answer on our chat box. And sa mga nakikinig po through radio and Spotify, pakisend po ang inyong sagot sa binigay na number kanina ni Sir Dante.
It's 0915-380-1112.
Okay, may sumagot na ito. One of the content of the video is all about keeping our food safe to eat and water safe to drink. Tama, nabanggit ko kanina yon.
Yes.
Diba, Sir Dante?
Yes.
Okay, meron pang sumagot. No? Sabi niya, another concern based from the video is the recommendation of vaccinations to keep our family healthy and helping countries survey on how many people get the immunization they need.
It's very timely, Ma'am Ana.
Oo, lahat yan naandyan. Then
Yung
may nasumagot
vaccination.
ulit, Sir Ives. It concerns also about ensuring good care for mothers before, during, and after delivery, including testing and treating for HIV and AIDS. Okay, nabanggit yan sa video. Meron pa ba, Sir Dante?
Ayan. Actually, I have received some messages from text. SMS, SMS, I should say. Nabubulol na ako. According to Mark George Abalos, nag-text siya. Sabi niya, ensuring availability of safe, modern contraceptive for everyone. And that is really presented a while ago on the motivation part or on the video. Wherein promoting healthy diet to prevent diabetes, and that's correct. Cancer and heart disease and understanding the needs of other people. Yan. Very good ang ating mga grade 10 learners. All your answers that you have texted and that you have chat on our chat box are actually correct, and that is a part of our motivational activity.
Okay,
Ma'am Joanna?
So, Those are some of the related issues that concerns on the national health trends, issues that is under our existing health-related law in safeguarding people's health. And that will be our lesson for today. So tutok na mga anak. Okay, let's start with the first one. Okay, we have Republic Act number 7394. What is all about this law? All grade 10 learners, please comment down your answers now. The code is buying. Ano
Yan.
kaya yan?
Buying is our code. Ano po kaya ang inyong sagot?
Okay, tignan natin. May sumagot na ba, Sir Ives?
Meron na ba? Meron na ba, Sir Dante?
Buying is the code. So far, wala pa, ma'am. Pero tingnan natin, baka nahuhuli lang.
Wala bang nag-text?
Oo, medyo nahuhuli itong aking...
Ayan. Ang sabi ni June D. Capule
Okay.
ng 10 Rutherford, it's, ano yung sagot niya?
Consumer
Act of the Philippines.
I-reveal nga
Yes.
natin. Yes, it's correct.
Yes, it's all about the Consumer Act of the Philippines. Bakit nga ba napaka-importante ng act na ito? Ano ang napapaloob? First one, it protects the people against hazard to health and safety, deceptive and unfair sales acts and practices. This is the legal basis for consumer protection in the country. The law embodies the state policy on the protection of consumer and establishes standards of conduct for business and industry in the country. Here in the Philippines, DTI, sir, di ba? Yung
Department of Trade and Industry.
Sila yung namamahala when we talk about consumer protection, yung DTI natin. And then, it also harmonized the rules regarding of the supply of goods, services, and digital content. Another, ano pa yung nakalagay dyan? The policy mandates for information, dissemination, and education. Itong ginagawa natin is an example of information, dissemination, and as educating those tayo na mga consumers. Kasi lahat tayo ay nagko-consume ng goods and services to facilitate sound choice. Ayan, mga choices and proper exercise of rights by the consumer.
Okay, tignan natin ngayon, lalong-lalo na, parating na ang Christmas season, tumataas na ang presyo sa palengke. Lahat na ng bilihin, ang lechon, ang karne, lalo na ang mga prutas pagdating ng bagong taon.
Yes, mga bibiluging prutas.
Pumapasok dyan ang law of demand.
Yes, from 300 pesos ang karne, ngayon ay 350 pesos na. Ang lechon naman, ayon sa balita, from 6,000 ngayon ay 6,500 na yung pinakamaliit lang yun.
Ay, ang taas.
Paano ba yan? No, tumataas ang presyo. Okay, sir.
Ano pa yung mga nakalagay dyan sa ano natin? Sa PowerPoint natin?
Okay.
If a consumer wants to complain, paano nga ba? What is the procedure? As a consumer, we have our rights and we have also our responsibilities na mga as a consumer. Ito, parang na-discuss na yung consumer rights, tama? Nung first quarter.
Yes,
Now, let us know what are the responsibilities. Number one is ask yourself.
Yes.
Okay? Another is be critically aware, be involved, be organized, practice sustainable consumption, and be responsible to the environment. Paano nga ba tayo mag-complain, Sir Dante, kung meron tayong problema? Una natin, alam natin, we have the Department of Trade and Industry. Sila yung namamahala sa Consumer Act dito sa Pilipinas. Sila yung nagpapatupad.
So, kailangan pag bibili ka, may resibo.
Yes, sir. Yes, ma'am.
Mamaya matatakal natin yan,
That is basic.
So, if a consumer wants to complain, unang-una, we have to identify the problem. So, napaka-importante na i-identify natin yung problem muna para alam natin kung paano ma-solve ito. And syempre, at the same time, may ibabalik natin yung product ng maayos sa pinagbilhan at papalitan naman yung product na ating binili. Then, at the same time, mare-refund natin yung money. Another is, O pwede rin yan, napaka-importante nito. We must show our proof of purchase. Ayan. So, yan yung pinaka-ebidensya natin.
Resibo.
Oo, ito yung pinaka-resibo. So, ito, yung magiging proof of purchase natin, yung mga receipts, yung mga magbibigay ng warranties sa atin na makapagsusupport sa binili nating products. Another is, report the complaint. Ayan. So, may karapatan tayong i-report yung mga yung mga improper na ginagawa ng authority. Pwede tayong mag-explain ng problem and tell clearly what action we would like to be taken. Then the last one is write a letter of complaint. O, ayan ha. So at the end naman, if we are contented with the response, we will write a letter of complaint to the protection of the agency concerned. Okay, yun yung mga dapat natin consider, Sir Dante.
If you're going to write for a letter of complaint, make it sure that you have evidences. Because generally, if your complaint and gumawa ka nga ng letter of complaint, just merely thinking it by hearsays, wala ka naman talagang basis, of course, makakakon rin yan, mababasura rin yan. Yan.
Okay. So, let's have the second one.
Okay, next is Republic Act 10354. Okay, so what is all about that Republic Act? The keyword is family planning.
Okay, comment down your answers, learners.
Okay. Republic Act number 10354.
Republic Act 10354.
According to Jennifer Guzman of 10SPJ, ma'am, sabi niya, it's Responsible Parenthood and Reproductive Health Act. Ayan, mukhang nagbasa na yata sila ng kanilang module.
Okay, tama yung sagot niya. It's all about Responsible Parenthood and Reproductive Health Act. What is this all about?
So, protect and promotes the right to the health of women, especially mothers in particular, and of the people in giving and instill health consciousness among them. No? Okay, so what is reproductive health, Sir Ibes?
Ano nga ba ito? Reproductive health is defined as a state of physical, mental, and social well-being in all matters relating to the reproductive system. Here in the Philippines, we have the Reproductive Health Act of 2012 or the RH law. Ano nga ba ang nakapaloob dito? It is a groundbreaking law that guarantees universal and free access to nearly all modern contraceptives for all citizens, including impoverished communities at government health centers. Meron tayong health law dito. Ito yung RH Act of 2012.
Favor ba kayo sa RH bill na yan? Ngayon, Sir Dante.
Reproductive health bill, okay? Actually, that is for protection and promoting the right for health of a women.
Yes.
Yes, of course. I'm in favor for this. Hindi naman gagawin yung batas na yan. That is actually, ginawa yung batas na yan for the welfare of women in particular, for the sake of those women.
Paano naman yung ating simbahang Katoliko? Parang hindi sila sang-ayon.
Actually, there are particular part na kung saan ikinoconsider ng ating church, and some part of it is actually they are against on it. Ang gusto lang naman kasi ng church, they are really on the protection and preservation of life. They want to undergo for natural method. Na kung saan yun naman ang gusto talaga ng ating simbahan. On the other way around, the state says na kung saan may mga ways pa aside from natural, they can use yun mga artificial na sinasabi natin, like the use of condom and other things under reproductive health.
Okay,
and in general naman talaga, Ma'am Joanna, it's up for the one who are using it, whether it's natural, whether it is on artificial.
Sa tamang panahon at tamang edad.
Yes, sir.
Darating tayo dyan mamaya. So sana maintindihan ng ating mga learners yung kahalagahan ng RH bill. So with that, we have the 4 pillars of foundation.
Okay, yes, we have the 4 pillars of foundation. Under the 4 pillars of foundation, we have to inform choice. Ayan, that's the first one. Anong sinasabi sa informed choice? As stated in the Act, effective and quality reproductive healthcare services, which is our ethical and medical safe, legal, accessible, and affordable, shall be given primacy to ensure the health of a mother and a child. So, we need to, kailangan ma-inform on the choices ang isang nanay. Karapatan niya yan. Okay? It's freedom to choose kung ano talaga ang gagamitin niya on that 4 pillars. Second, we have respect for life. Ayan. Family, ayan, nakalagay dyan, abortion. No to abortion na it must be pro-life tayo.
Yes, pro-life.
Okay, pro-life. Recognizes that abortion is illegal and punishable by law. Take note of that. However, mother will be identified to have aborted an unborn child, will be served with post-abortive treatment and counseling in humane, non-judgmental, and compassionate manner. Respect for life. There are some instances kasi na kung saan hindi naman sinasadya yun pagkaka-abort ng bata, nalaglagan. Ang term na the right term is miscarriage. Ayan.
Hindi lang sa law, sir, di ba? Against the law of God also.
Oo. It's a little big no-no. It's actually hindi lang sa part ng babae, pwede rin sa part ng lalaki. Yan. Huwag kayong magpa-abort kasi masama talaga ito. O paano naman yung mga kwan, ma'am?
Ipaampon nyo na lang po sa akin.
May mga issues kasi regarding teenage pregnancy. Very rampant kasi sa part ng teenage pregnancy ang abortion. Pag nabuntis ang isang bata, please, wag ninyo, pangatawanan nyo ito, kailangan nyong iluwal yung bata na yan para sa ganun ay hindi wag tayo mag-violate.
Face the consequence.
Okay, mamaya yan, ipapasok natin yung teenage pregnancy na yan.
Okay, respect for life.
Okay, another pillar is the birth control. So kanina, binanggit ni Sir Dante yung choice ng birth control na i-decide ng isang couple na dapat gamitin. So, reproductive healthcare information and supply shall be made available, most especially to poor beneficiaries. However, the Act provisions also tells that the government must respect the citizens' individual preferences and choice of family planning method. So, dalawa yung pwede nilang pagpilian. We have the artificial method and the natural method. Nasa kanila na yon kung paano nila gagamitin in the proper way. Then we have also the responsible. Meron pa ba, Sir Dante?
Ma'am Joanna, sa part na yan, nag-undergo, kapag nag-undergo ng family planning, parenthood, and reproductive health ang ang mag-asawa, nadidiscuss actually yan ng ating health concern.
Yes.
Pag pinamimili niya, ano ba ang gagamitin nyo, ganito, ganyan, bibigyan sila ng mga preferences, what to use.
Yes.
Pero kailangan may check-up pa rin yun.
Yes, Ma'am Ana.
Okay, binanggit nyo na rin lang ang family planning. Ano ba ang tinatawag nating family planning? It is the ability of individual or the couples to anticipate the desired number of children and the spacing of timing of birth. So, napaka-importante.
Ang cute talaga ng PowerPoint. Talagang gumagalaw yung mga birth control. Ayan. Sige, tumatambling. Ano ba yung mga tumatambling na birth control na yan? Condom. Ayan. Ano pa yan? Mga yan.
Pills.
Ayan. Mga contraceptives yan, mga
Kasi
yan.
pag inisa-isa pa natin ngayon yung mga birth control na yan, matatagalan talaga tayo kasi kinakailangan yan ng isang period talaga para pag-aralan ang mga birth control na yan.
Yeah.
So, pahapyaw lang muna. Another pillar is the responsible parenthood. Napaka-importante nito, mga anak. So, may panahon na yung pagiging isang magulang hindi madali. Kinakailangan na yung couple ngayon dito, i-determine nila yung ideal family size. So, in addition, yung government shall equip each parent with needed information in all aspects of family life or the reproductive health and this pillar. So, yung mga bata, yung mga anak natin na medyo nalihis yata ng landas at nagkaroon ng teenage pregnancy.
Ang question, Ma'am Joanna, kailan ba talaga magiging isang ama at kailan ba, ma'am, kailan ba yung time na pwede na magpakasal. Siguro bigyan natin ng konting pahapyaw in regards to responsible parenthood para sa ganun ay mabigyan ng information ang ating mga learners.
Dito sa Pilipinas, may standard kasi tayo kung kailan pwedeng mag-asawa, kailan pwedeng mag-anak, di ba?
Ano, Sir Ives? Ang para
18
sa
and
babae,
above, ano?
Para sa babae.
Ayan.
18 yung legal. Pero kinakailangan pa rin ng parental consent yun.
Yan 18 na yan, it's actually hindi pa rin yan yung, kumbaga, that's the legal basis. That's the legal basis. Pero, ang assurance ng pagiging responsible parenthood, you need to ask yourself. 18 years old na ako, kaya ko na ba? That's the person. There are a lot of things that is to be considered. Ayan. That is your readiness ng isang babae, readiness ng isang lalaki. Okay na bang, are you economically stable?
May trabaho
May trabaho ka na ba? At yun, syempre, in general, ready na ba ako maging isang ina o maging isang ama?
Ready ka na ba, Sir Dante?
Maging isang ina? Ready ka na ba maging isang ina?
Ready na ako maging isang ama at maging ina para sa aking mga pamangkin.
Kaya wag po kayo magpa-abort, ipaampon nyo na lang.
Paampon nyo na lang sa amin. Amin na lang yan.
For those naman from 21 to 25 years of age, parental advice ang kailangan nilang i-secure. So, napaka-importante sa babae. I think sa akin, yung edad na 27 to 30, then financially stable ako, pwede nang mag-asawa.
Ayan, paalala lamang po sa ating mga parents na nakikinig sa amin ngayon. May mga bagay po kaming pinag-uusapan na medyo sensitive po. Kailangan po ng ating mga anak ng patnubay para sa ganun, gabay. Para sa ganun kapag may mga question po sila na hindi po namin masagot dito, maaaring po kayo po ang magbigay ng explanation para sa ating mga anak. Kailangan po nila ng gabay.
Kaya nga meron tayong responsible parenthood. Kayo pa rin po ang dyan, ang kasagutan dyan.
Ayan, pagpatuloy na natin, Ma'am Joanna, ang dami nating mga inputs.
Okay, what are the benefits of going to use the family planning method for the married couple, Ma'am Ana?
Okay, for married couple, family planning is preparation for responsible parenthood. When a couple agrees to practice this, they will only have the number of children they can afford to support. Therefore, there will be no unwanted pregnancy for the couple. They will still have enough time to enjoy each other's company without having too many children to attend to. Huh? Okay, so how about for the mother?
Okay, for the mother, family planning helps maintain good health and give us sufficient time between pregnancies to recover from the strain of children. So taking a 2 to 3 interval for delivery helps a mother to recover and regain health. It gives us freedom to have children only when we want and only when I am ready, I should say. Pag ready na ulit ako magkaanak, why not? Then, it gives us also the opportunity to attend to our own needs.
Sabi
so,
niya,
yan ha?
2 to 3 years interval daw.
Parang hindi naman yata 18 years, 20 years interval. Okay, how about for the children?
For the children, Ma'am Joanna, family planning get quality time and attention for their parents, and they are better taken care of. Parents could meet basic need of the children. They can buy food, clothing, and shelter. Children can receive the health care they need. The parents can provide them with a good education, of course. Most importantly, children will be showered with love, receive proper attention from their parents. What about family planning on the other part, on the part of the father? Ma'am Joanna.
Sir Francis, Sir Dante, and Sir Ives, magiging father din kayo balang araw.
Tatay na ako.
Tatay na po ako. Ang dami ko ng anak.
Okay, shoulder his responsibility and enables you to give equal attention to your children. It also lightens the burden on your part to support your family. It gives your family a better home, education, and good future, and keeping your family better and contented. Paano naman sa community?
Okay, for the community, it improves our economy and social status. It can provide a peaceful, orderly, and self-sustaining community with fewer problems like juvenile delinquency. The community will be a healthy place to live with more land, open spaces between houses, playground, sanitation, and less pollution. In that case, peace and order are paramount importance in every community. How about for the country and the whole world, the universe rather, Sir Dante?
And with the rapid growth of population in the country and the world, resources are being used more rapidly. Health problems also worsen as modern medicine is not able to keep pace with the health crisis. Population growth has been a source of numerous economic problems. Yan. By observing family planning for community, the use of land, food, and fuel can be reduced, and sanitation control would be effective. There would be fewer countries suffering from starvation brought about by population explosion. So therefore, it is really nice to think first of family planning. We need to plan for the future in order for us to eradicate or lessen population explosion. That is one of the problems of the world right now. Sir Ibes?
Yes, the third one is Republic Act number 8504. The code is transmitted. Ano po kaya ang sagot natin dito?
According to Hasli Sagibo, sabi niya, it's Philippine Aid Prevention and Control Act of 1998.
Ano kaya ito?
And she's really correct.
Oo, tama. So, what is under this law? First one, provides for education and information dissemination in various institutions and agencies, safe practices and procedures in health organizations and associations, monitoring of cases with confidentiality, and programs for anti-discriminatory act. Yan ba yon?
Yes.
Di ba yung Philippine Aid Prevention and Control Act of 1998? It talks about HIV and AIDS. Okay? Promotes public awareness related to HIV/AIDS that causes modes of transmission, consequences, means of prevention, and control.
And over 30 million have HIV or AIDS worldwide. So, dumadami na, ano?
Pero may gamot na yan.
Oo. May gamot na ba, Sir Dante, ang HIV?
So far naman, wala pa yatang gamot na kwan. But, we can at lessen the tawag dito yung adverse effect of HIV and AIDS. Pag meron kayo, huwag kayong matakot.
May method.
May method na o may mga processes na ginagawa ang ating mga health officers in order for us to lessen the impact of HIV and AIDS.
Papayaw nga tayo, Sir Dante, about the SOGI. Ano yung tungkol sa SOGI na yan?
Ang SOGI bill is actually sa part yan ng mga LGBTQ wherein they are asking they are asking for equal rights. Ayan, equal rights ng kung ano yung rights ng para sa babae, ay rights rin para sa members ng LGBTQ.
Okay. So, how can we help those living with HIV or AIDS? Unang-una, we have to talk to the person concerned, listen and learn. So, kinakailangan alamin din natin kung ano yung pinagdadaanan ng taong may HIV. Another is encourage for treatment. So we are the one to encourage the one na concerned dito. Then we have to support the medication, the adherence, and fight for themselves. So palakasin natin yung loob ng mga taong may HIV. Hindi dapat natin pandirihan, di ba? Kasi yung iba, alam nila pag hinawakan lang, mahahawa na.
No.
Okay. So another is
Another related law is under Republic Act number 7719. Our code is blood bagging.
Okay. Comment down your answers now, learners.
Republic Act number 7719.
Sabi ni Shirel, nakita niya raw yan sa Red Cross. Red Cross sabi niya, and that is the National Blood Services Act of 1994.
Yes, tama.
So ano ba itong Republic Act na ito? Okay, promotes and encourages voluntary blood donation by the citizens and to instill public consciousness of the principle that blood donation is a humanitarian act. Provides adequate, safe, affordable, and equitable distribution of supply of blood and blood products. No? So, kailangan mag-donate pala ng blood. No?
Ma'am Joanne, ano naman ang Republic Act? Republic Act number
So
10175.
ano yon, Sir Dante?
The code here is computer.
Okay, tignan natin. Okay, tigbalikan ko lang sandali, Sir Dante, ha, yung, ano to, yung, yung,
Requirements
ng isang
Potential
blood
blood donor.
So, kinakailangan, must have a weight of 110 pounds to
50 kilos siya.
to 50 kilos. So merong mga formula na dapat na sundin sa pagkuha o pag-convert ng pounds to kilos. Okay. So kanina binanggit ni Sir Dante, another is pulse rate between 60
and 100
beats
per minute.
Then yung hemoglobin niya at least 125 liter ba yan?
Oo,
Okay,
per
so yan.
Tapos
so,
hindi siya high blood dapat.
Oo, sa high blood dapat yan. Then kayo,
Hindi pwedeng
Republic Act number, ang sabi mo, Sir Dante?
Republic Act number 10175.
Ang code is?
Computer.
Okay, tignan natin. Okay, sumagot na yata. Okay, ang sagot dyan ay the Cybercrime Prevention Act of 2012 according to Minerva Kurameng. What is all about this? Okay, Cybercrime Prevention Act of 2012 punishes content-related offenses such as cybersex, child pornography, and libel, which may be committed through a computer system. Okay, yan ha, ano ba yung tinatawag nating cyber? Refers to a computer or a computer network, the electronic medium in which online communication takes place. So how can we protect ourselves against cybercrime?
Okay, we have here number 1. Use a full-service internet security suite. Then, use a strong password. Okay, dapat yung password ikaw lang ang nakakaalam din. Then, keep your software updated.
Okay.
Ano pa?
Okay, next. Manage your social media settings. Strengthen your home network. And talk to your children about the internet. No? Okay, next.
Then we have to keep up to date on the major security breaches, know the identity theft that can happen anywhere, keep an eye on the kids, and know what to do if you will become the victim. Okay, Sir Dante.
And of course, keep an eye also on the kids. Know what to do if you become a victim, sabi ni Ma'am Joanna.
Importante na think before you click.
Yes, think before you click. Ayan, ang daming natutunan ng ating mga grade 10 learners. Ayan.
Now that you have learned the different related laws in safeguarding people's safety, let us check how far have you understand our lesson. Do the activities and assessments that are prepared for you to work on. Answer the What's New Activity 1 on page 1 of your learning activity sheet. Directions. Complete the given statements. Write your answer on a separate sheet of paper.
Okay, another. Sa performance task naman yung mga anak. No, makinig. Make a slogan about cyberbullying. Okay. Use not more than 12 words. You may use any kind of clean paper. Okay, for our rubrics for the performance task, content 50%, creativity 20%, originality 20%, neatness 10%. Okay, slogan about cyberbullying ang yung performance task, ha? Okay.
Okay, so ano yung mga napag-aralan natin ngayong araw, mga grade 10 learners? We have learned about the different health-related laws that mga various concerns, and it's our duty as citizens to abide by and promulgate those laws.
We have learned also that those health laws serves as a protection and general safety that ensures our rights as citizens against abuse by the other people, organizations, and the government itself.
Okay, for another question to be answered, okay, tigtutukan nyo na mga anak, this is the situation. A couple is getting married in a few months. They are required to attend seminars on family planning. So, you will tell what health policy How does the law affect the character? And what advice would you give the couple? May sumagot na ba sa ating chat box? Ulitin ko ha, yung situation is, a couple is getting married in a few months. They are required to attend seminars on family planning. So what health policy? How does the law affect the character? And what advice would you give to couple?
Pwede din ninyong i-send yung sagot ninyo sa mga MAPEH teachers ninyo, sa mga nakikinig sa ating RBI.
What health policy? It's the first one. At ang sagot ni Micaela Madrid is family planning. Tama ba, Ma'am Joanna?
Yes.
Yung policy?
Family planning
sir.
ba?
Ayan.
Anong act ba yun? Responsible
Responsible Parenthood.
and Reproductive Health Act.
Okay, that's the policy.
How does the law affect the character?
Ayan, may mga sumasagot.
May mga sumasagot. Responsible Parenthood and Reproductive Health. Ayan. How does the law affect the character, Ma'am Joanna?
O paano nga ba nakaka-affect yung law na yon sa mga character? So in that case kasi, bago magpakasal ang couple, dadaan muna sila sa tinatawag nating seminar. So yung seminar na yon ang makakatulong din sa kanila, makakapag-enlighten sa mga character kung ano yung pamamaraan ng family planning na gagawin nila.
Ayun, sabi ni John na Jamaica Tangonen, ang haba ng sagot. It's responsible parent. The law affect the character through their mode of thinking and standard of living. Sabi niya sa student, may advices to couple is to go for it if they can handle the responsibility of having their own child. Very good, John na Jamaica Tangonan ba ito? Ng 10 men to live.
Yes.
Ayan, very good. You're very responsive on this particular part. Yan, on that evaluation part. Ang ganda ng advice niya.
Ang daming sumagot. So, babasahin na lang natin. According to Rysel Eligado, mothers, children, fathers, and families all benefit from family planning. It allows the mother to provide enough time and attention to her husband and children. Ang galing ng ating mga learners. Okay.
Ayan. So, I think our learners learned a lot on they have shared actually the different policies. They have given, they give also advice, and it shows that it's a manifestation that they really learn. Okay? For our last activity on the reflection part, this time let us try to give our personal reflection about the topic by sharing our idea on the question, why is awareness is important in the national health trend? Issues and concern in relation to the existing health-related laws. Okay, Ma'am Joanna?
Okay, bakit nga ba kinakailangan natin maging aware? So ito yung magiging fundamental tool natin para ma-assist, ma-protect ang mga tao from threat to health and prevent yung mga diseases na nag-strive sa ating mundo, lalo-lalo na sa mga may kinalaman sa ating mga kabataan, pagdating sa teenage pregnancy, and as well sa mga cybercrime na marami sa mga bata ngayon ang gumagamit ng gadget na hindi nila iniisip kung tama ba yung kanilang mga pinopost. Okay, Sir Dante.
Okay, what about you, Sir Ibes?
Ano kaya iniisip ko yung
Gusto ko mamaya ako ang sasagot last.
Sa akin, it is very important to know those rights. But of course, sa akin naman, nabibigyan tayo lahat-lahat as a consumer, as a citizen here in our world, in our country, nabibigyan tayo lahat-lahat ng rights natin. Now, the thing is, ang dito, importante is know also our responsible. Diba? Nabibigyan tayo ng mga yan. Pero ano nga ba yung kailangan din nating gawin? Hindi yan magiging effective. Hindi yan magiging successful kung tayo mismo, hindi natin susundin talaga kung ano yung mga nasa batas natin at kung ano yung nasa law natin. Be responsible also as a citizen.
Ma'am Ana?
Okay, sabi nga ni Sir Ibes, no, maging responsable sa mga laws na pinatutupad. no? At bilang isang mamamayan, no, kayo bilang isang kabataan, dapat maging responsable din kayo sa lahat-lahat, no? Okay. Yun lang, maging responsible sa mga laws na pinapatupad at laging ingatan din ang inyong mga kalusugan, no? Mag-ingat sa lahat-lahat.
To conclude on the reflection part, based to Ma'am Joanna, Ma'am Aina, and Ibes, the word that really transpired is sense of responsibilities there. We need to be responsible. And second, we need to practice self-discipline always. And of course, obedience must be there. We need to abide on the laws given by our republic as a citizen of this country. And always bear on your mind that you need to know your rights as a citizen of this country para sa ganon alam ninyo. And always bear on your mind that ignorance to law excuses no one. So therefore, every now and then, we need to exercise that right. We need to review. We need to reflect on those rights that we have and those laws that is given by our country so that we can follow it up. I repeat, ignorance to law excuses no one. Ayan. Before siguro, Ma'am Joanna, na ibigay mo ang closure ninyo, I would like to remind everyone, grade 10 learners and all Christmas. Please be reminded that the deadline will be on
17.
December
17.
for your entry. Ayan.
Sa Friday na po.
Sa Friday na yan. So, please be reminded on it for the submission. Ma'am Joanna?
Okay, so that ends our discussion for today in Health 10. Congratulations, we are done with our lesson in Health 10, and I hope you enjoyed and understood our discussion for today. So let me end this discussion with a quote about God never sends you into a situation alone. God goes before you. He stands beside you. He walks behind you. Whatever situation you have right now, be confident. God is with you always.
Ayan, Merry Christmas in advance and a Happy New Year to all of you. Yan, magbabalik ang airing ng
Okay, thank you everyone sa MAPEH.
Music, arts, physical education, and health. Mga aralin na dapat malaman, inyong tututukan dito sa 106.3 Dance Radio. Ang istasyong magbibigay ng edukasyon kahit saan man at ang silid-aralan sa radyo. 106.3 DWDR-FM. Sa MAPEH, learning is amazing! Ito ang 106.3 Dance Radio. Dance Radio.
Prepare yourself.
Ang silid-aralan sa radyo, hatid namin ay makabagong paraan ng pagtuturo at kaalaman. Mapaumaga, tanghali o hapon man yan. Ang istasyong magbibigay impormasyon kahit saan man.
For something big.
Alright, here we go. 106.3 Dance Radio. Doña Aurora National High School, Santa Rita, Aurora, Isabela. This 106.3 DWDR-FM.